You cannot recover from a depression while regularly using any substance that impairs the performance of your brain and mind. But I want to strongly emphasize that you should first seek professional advice before you change how you take any of your daily or regularly used medications, any of your daily or regularly used social drugs or herbal remedies. Suddenly stopping any substance that has repeatedly been a part of the biology of your brain can lead to a rebound effect, which creates strong opposite reactions and will add considerable emotional and physiological stress to your day, extra stress that you do not need right now. For example, suddenly stopping an anxiety-reducing medication can create panic attacks, insomnia, and paranoia. Suddenly stopping antidepressants can actually increase the symptoms of depression. Seek professional advice before changing your normal pattern of using medications, herbal remedies, drugs, and alcohol. This is important because these different substances can prevent your recovery, and they might even weaken you to the point where you attempt suicide. The truth is, I have never yet been able to help a client to recover from depression while they are still using any substance, drug, herbal remedy, or medicine that impairs their ability to think rationally, or which made them more emotionally unstable, or acted to dull their ability to deal with the demands of a situation. These different substances persistently weakened them. These substances made it harder for their brain and mind, which were already struggling. I have found that even marijuana will prevent recovery from depression. Read this section to find out what substances put you at risk while you are suffering this dangerous disorder. Alcohol and social drugs are obvious, but some commonly prescribed medications and even herbal remedies can weaken you. When you are 100% taking a medication, social drug, or using alcohol might impair your mental and emotional stability over the following day by as much as 10 to 30%. When you are 100%, you can easily tolerate this deficit in your ability to perform your daily duties. Indeed, you might not even notice a deterioration in your mental and emotional stability and performance. But what if you're 50% or even below 40%? Then using the same medication, drug, or alcohol can be the difference between life and death. My name is Sydney Johnstone. I'm a clinical psychologist. Once you are fully recovered, you can return to using social alcohol or drugs or medication to whatever level you find satisfying. But until then, do not take any substance that impairs your brain and mind and which makes it harder to think, because your brain and mind are already struggling. Read this section because you need to know what might be preventing your recovery from this dangerous disorder. But I again emphasize, do not stop using any of your medications, any of your regularly used social drugs, or any herbal remedies without first seeking the advice of an appropriately qualified professional. Do not risk making your situation worse. Seek professional advice.